Good morning.
Hello.
I'm Dr. Harris. Good to
Hi,
meet
Dr.
you.
Harris.
Who do we have here with us today?
This is Davy.
Oh, Davy. Hi, Davy. Hey, you like our toothbrush, huh? That's good. Good news. All right. So is this Davy's first appointment?
It is.
All right.
It is.
So what made you bring her in today?
She's actually, we just really wanted to come in and, for her first appointment, I figured 1 year old, it's
Wonderful.
time to come in. She's got a few little spots on the backs of her teeth.
Okay.
And so I kind of wanted you to check those out and just kind of tell me what you think about those.
Absolutely. And it's great that you're bringing her in at 1. I know a lot of parents think that that's early, but actually the AAPD, so that's the American Academy of Pediatric Dentistry, they recommend that babies come in as soon as their first tooth erupts or at least by the age of 1. So it's like a wonderful time that you're bringing her in, not too early at all.
Okay.
So today we just want it to be, a really non-intimidating visit for her. We're going to do something that we call a lap-to-lap exam.
Okay.
So she's going to still feel comfortable because she's going to be, on mom's lap still, and we're just going to try to, make her feel as comfortable as possible while we do this because it is a little bit of an awkward situation, of course, for little ones. So what we're going to have you do is have her facing you, okay?
Okay.
I'm just going to put my clips on here.
Sit Mama's lap. Sit Mama's lap. I think you like Dr. Harris, don't you?
Yeah, she
Oh, I know, Davy.
I think her likes Dr. Harris.
All right, Davy.
What are you going to do?
I know. I think now she's getting a little.
Yeah,
What are
she's
those?
getting nervous. What are those,
Hey.
Sissy?
Davy, do you want to touch them? Huh?
She's like, oh.
Can you touch her gloves?
Yeah.
You can do it.
No.
She's interested in this toothbrush. I guess that's a
Yeah.
good thing.
All right. So, can you tell me a little bit about your home oral hygiene techniques right now with Davy?
Sure. We use a toothbrush pretty much like this.
Awesome.
It's a little bigger. And we use just the Colgate for kids.
No fluoride, correct?
No.
Yep, that's wonderful because at this age, she's not able to spit on command.
Right.
And so we don't want her ingesting any fluoride at this time. Sometimes babies end up using toothpaste with fluoride in it, and that can cause them to have something we call fluorosis on their permanent teeth.
Okay.
So right now her permanent teeth are in a developmental stage, and that fluoride then causes those to often have little white spots or brown spots later on.
Oh,
So that's really good that you're staying away from that. I actually recommend Tom's.
Okay.
It doesn't have any fluoride in it. It has like a natural flavor, so it's not, some kids call it spicy,
Yeah.
with toothpaste a lot of
Right.
times. And so it's just one of the two that I recommend also. Has Davy had any issues teething, any pain
No.
or anything like
She
that?
doesn't
Wonderful.
seem to be, she had a little bit with her bottom teeth, it seemed like, but other than that, it's nothing like I heard it was going to be, so.
Great. Now, if in the future she does have, any discomfort, I would like to let moms know to stay away from Orajel.
Okay.
And so sometimes that's the go-to thing for a lot of moms is just to get some Orajel off the counter, rub it on their gums.
Yeah.
However, the Orajel does have about 20% of benzocaine in it, and it can be toxic to little ones if they have too much and ingest too much.
Okay.
So also I'll recommend a brand is called Newbie, and they're just little organic teething tablets, and they often do the job.
Great.
Okay. All right. So we're just going to do a little quick exam on Davy. Lucy, do you mind grabbing me a mirror?
Do I need to just?
Yeah. All right.
Right, Sissy?
Hello.
Open your mouth if you get the mic.
Hello, Davy. You know what? I'm going to scoot my chair up just a little bit, okay? Okay. Hang on, Davy. And if you want to just, oh my God. Davy, you like my hair. All right. I'm going to have you scoot her back just a little bit.
Okay.
And then I'm going to lift my seat up, okay, Mom?
Okay, go ahead.
So right now I'm just going to look at Davy's teeth, my little mirror here.
All right. Here we go, sis.
All right, sister. Let's see. Wonderful. Oh, wow, this looks like one of those back molars is starting to come in.
Yay.
It's so good. All right, sister. And I'm just going to like fill her gums in the back. Oh, okay, baby girl, you're all done. Wonderful. So the great thing is Davy's teeth look really beautiful.
Oh, yeah.
Mm-hmm.
Okay.
Yes, any types of little spotting or anything like that, that's just a little discoloration on her teeth. I'm not sure if she ever drinks any dark juices, maybe any grape
She
juice.
used to, but we stopped that because it
Okay.
scared me.
Yeah.
So water and milk is all she's getting.
Okay. And so, of course, the water is always wonderful, but I do want you to know, milk does have quite a bit of sugar in it. And so, actually, the only thing that causes cavities is 97% are caused by one particular bacteria and sugar. You have to have both of those components in order to have a cavity. Without one of, or the two, or both of them, you can't have a cavity. So the biggest thing about preventing cavities is actually the manual brushing. So a lot of parents, they might say that their children don't like the toothpaste, they don't like the feeling of it, and that's why I always tell them, hey, Davy, can I see your toothbrush?
Look, let her see.
These are very, very safe toothbrushes for little ones because what it does is if they're running around, which some of them do, they end up liking their, can you open that for me, Lucy?
All the time.
They end up liking the toothbrush, or they start to suck on the toothbrush, and I don't want them to feel like they can't, have the toothbrush. So these little ones here, as you can see, it's easier for them to hold as well. Then also, if they're running, this is so short that it's not going to choke them or anything like that. And so, if for any reason hey, you like toothbrushes, don't you?
We let her,
That's
play with
great.
hers to kind of get used to it.
That's wonderful. And then, of course, if you can just go behind her and brush good, we always recommend that in the morning and at nighttime.
Okay.
And then after she does her last brushing at night, no sugar, no milk, just water for the rest of the night. If for any reason she does happen, to need a little juice or something like that, and you don't have that toothbrush handy, we also have little products called newbie wipes. I got these little wipes in Davy's bag. In the morning, if you can just wipe her little mouth out, and at night, just wipe her mouth out, and very, very easy. Very easy. And Mom, if you want to try them, you'll see that they don't taste funny or anything like that. Davy, can Mom wipe your teeth?
Can Mom wipe the teeth? Maybe. Hey, can you open? Open?
Oh, thanks,
you want to
Davy.
bite on it? Yeah, what do you think?
Wow, Davy, good. And Mom, if you want to too, you can even wrap it around your finger,
Okay.
and then and I can kind of demonstrate that to you.
Okay.
The milk can accumulate behind the teeth, and so cavities sometimes form. Parents don't see them because it's behind.
Right.
Because when they're sleeping, it just pulls up behind there. So.
Oh, okay.
And also, you always even want to keep the gums clean.
Okay.
So our focus is going to be the entire oral cavity, the gum tissue, the teeth, even the tongue. Okay. All right, but I would say that Davy had a wonderful, good checkup. And it's just great. We always want to recommend that you come every 6 months.
Okay.
Right now, she has quite a bit of spacing. Now, however, when all of her baby teeth come in, her teeth are going to get a little bit closer together, and that's when you really want to start implementing flossing. Okay? And I know it sounds kind of early, and little flossers is something that you can use. Are you familiar with those little small ones that you can get?
Yes.
No brand is recommended. You can get any of those.
Okay.
And, just kind of get her used to that.
Okay.
Because when she's 6 years old, or around 5 or 6, 5 to 7, her 6-year molars will come in. That's when they'll get really close.
Okay.
And that's when we start seeing what we call interproximal carious lesions. And so those are the cavities that form in between the teeth. Right now, her saliva is kind of washing through because all of her teeth are still spaced apart nice. And also, Mom, I want you to know that Davy having those spacing in between her teeth is actually a good thing.
Oh, good.
So a lot of parents want their kids' teeth to line up perfectly right now. But since she's a baby and her permanent teeth are going to come in eventually, we like that spacing because that means that we're going to be hopeful that she has enough room for those permanent teeth to actually come in because, as you can imagine, they're about 2.5 to 3 times bigger than her baby teeth.
Right.
So, any questions that we can answer for you?
I think you've answered all of them.
Okay.
Yeah, the getting
Wonderful.
behind her is going to be helpful.
Yes.
All of this is really going to be helpful.
And just a little more, educational information for you. and why it's so important for her to come this early. Childhood caries is actually the #1 cause of missing school days now. Way over the common colds. I think there's just been a little bit of a disconnect between the pediatric dentists and the pediatricians kind of working together to make sure that parents know that early on. So that's something that I know a lot of my colleagues are really trying to push, and we're trying to, kind of bridge that gap in between pediatric dentists and pediatricians so that we're able to make sure that either they or us are able to give parents that information early on.
Right.
Well, thank you.
Absolutely.
I'm
You did so good, Davi. So, of course, this is her first appointment. She's 1. She's not really super aware of all of her surroundings, so this won't be just her first happy visit.
Right.
When she gets a little bit older, so around 5, okay, I want her to come in again. Of course, we'll be seeing her every 6 months, but at 5, we want her to also come in and have more of a tour of the dental office and get used to maybe the prophy cup, and that's where we actually, brush with a little spinny brush and things like that. Get used to laying down. And so the dental environment then doesn't become an intimidating thing for Davi and other kids. Absolutely. So we want to have a lot of good visits where we're not having to talk about cavities, hopefully ever.
Right.
But if that time does come, because it can happen to any of us, we want her to already feel very comfortable with the environment and know that it's not anything to be afraid of, and feel comfortable laying back on the seat. So thank you so much for coming in early, and we'll definitely get you a 6-month appointment scheduled.
Thank you so much.
All right.